So every 4 minutes, someone in the Kansas City area needs a blood transfusion. Whether that's a cancer patient, a sickle cell anemia patient, trauma victims, or mothers in labor, nearly 600 units of blood are needed in the Kansas City area each and every day, and Community Blood Center exists to meet that need. Community Blood Center is the primary supplier of blood products to over 90% of the hospitals in our region. Blood drive coordinators, lab techs, phlebotomists work round the clock to ensure that blood is ready and available for patients when they need it. But our most valuable team members are blood donors. Meet Kendra, a nurse at Allen County Regional Hospital. In her profession, she sees firsthand just how important blood donations are to the lives of sick and injured patients. Over the years, Kendra's donated over 20 units of blood, and today she's here at Community Blood Center to donate again and bring us along for the ride. The first step is registration. You'll check in with a team member who will take down your basic contact information. Make sure you bring a photo ID or blood donor ID card. For step 2, you'll answer questions about your medical history and recent travel. For step 3, you'll sit with a member of our team who will perform a short physical, checking your temperature, blood pressure, pulse, and hemoglobin.
Right on the money maker.
From there, you'll move to step 4, blood donation. Our team members are extensively trained and good at what they do. You'll barely feel the small pinch, and about 10 minutes later, we'll have a pint of blood. The fifth and final step is a fan favorite, refreshment. Munch on some cookies, drink some juice, and rest easy knowing you just saved 3 lives. So if you've ever wondered where a blood donation goes after it leaves your arm, the first stop is the components lab. Every blood donation collected in our entire service area gets processed right here in Kansas City. Our lab techs work round the clock to process each unit and separate it into its parts: red blood cells, platelets, and plasma. Red blood cells are often used to treat patients with iron deficiency or anemia and trauma victims who've lost a lot of blood. Plasma transfusions are often used for patients with severe infections or burns, and platelets are commonly used for cancer patients undergoing chemo treatments. Each unit is tested to ensure it's safe to be transfused into a patient. After the blood is processed and tested, the unit moves on to our distribution department, where it's packaged into specialized coolers and sent to one of our local hospitals. Community Blood Center provides over 90% of our region's blood needs, supplying to hospitals such as the University of Kansas Health System, Children's Mercy, North Kansas City Hospital, and many more. From our distribution department, a team of couriers and dedicated volunteers transport this blood to our local hospitals.